American Trends. We only talk about what your social media says is trending. So let's get right back down to it. Hillary's health has been trending this week. The mainstream media can't even ignore the constant coughing fits that she's having in public, and her campaign is not happy with Hillary's allies in the media. Clinton's press secretary Nick Merrill shot back at NBC News reporter who did the report on Hillary's coughing fits. Merrill tweeted, "Dear at Andrew NBC News, get a life, thanks, Nick." That tweet is a clear shot across the bow of the press saying Hillary's health is off limits. But is Hillary's health fair game? Here to discuss, psychotherapist Dr. Lisa Palmer. Dr. Palmer, welcome to American Trends.
Thanks for having me.
All right, Dr. Palmer, Hillary seemed to have a good day yesterday. She didn't have a coughing fit at the NBC News Forum, and she didn't have a coughing fit today. So that's 2 whole days in a row. And a new record. I have to tell you, I don't feel good about this topic. I don't think this is the right topic. It isn't an issue, and it bothers me, not when people discuss it, but when they act gleeful over it, which I realize you're not doing, but you do see a lot of that in social media. I've had times on TV where I've needed to cough, or on stage, or whatever. It happens. So do you think that we should go easy on her regarding a cough?
Yes, because things can be taken out of context, and especially symptoms being taken out of context. And I really do believe that the media has a case of hypochondria, if you will. You know, Hillary Clinton coughs, and it's like we want to Google it and figure out the worst case scenario as to what could be causing this. You know, Hillary Clinton has hypothyroidism, and I think that that's probably one of the more serious issues that we should be looking at. But a lot of people actually suffer from hypothyroidism, and one of the side effects of that could be gastroreflux issues. And if she has that, it could actually induce coughing. I'm not saying that's the case, but that could very well be an issue.
And so how concerned, or how much business is it of the American people someone's private health issues? Because there certainly comes a point, certainly Uma Abedin is one who suggested that Hillary does have frequent memory lapses. I can see why that is a concern. I think that's a very legitimate concern, and certainly as a psychotherapist, you would understand why that would be a concern to the American voter. So where do we draw that line between what is her private business, something like hypothyroidism? I don't know. It does make you sleep more, so maybe it's arguably, but that's my question. Where is that line?
Well, she's running for a public office, so people are definitely very curious about her and want to make sure that she's in good health. But a lot of problems that she has, people have. She did have a concussion. How many of us have fallen off a bike or gotten in a car accident, had a concussion? As part of her healing process, she had to rest for quite some time. And oftentimes when people rest for a long period of time, they can develop blood clots. And that's actually a perfectly normal thing for someone who rests for a long period of time. She was treated by doctors who took care of that. And it's actually being looked at now, something that happened 4 years ago, as to, is this something that's actually affecting her now and making her cough and giving her different problems? Likely not. Look, she's the presidential nominee. She's undergone a lot of pressure and a lot of stress just being Hillary Clinton, and she's made it this far. So obviously she can deal with that level of pressure and stress. And by the way, she was a Secretary of State. She's had, she was a First Lady. She's has the best health care out there. I mean, if she doesn't have the best health care, who does? So we have to trust her doctors to some extent.
And I think maybe that's where some people are going with this. I know Dr. Drew Pinsky brought up her poor treatment for her hypothyroidism, and he ended up losing his job. Now, I talked to him personally. He says that wasn't the reason he lost his job. But, do you agree that there could be something going on here, and that perhaps the American people, if she's asking for their vote, might be entitled to her health records, so they could just know, hey, this is no big deal. She had a concussion. She's had no after effects, or she does have after effects, and these could be affecting her memory. Because in fairness, she was asleep the night Benghazi went down and 4 people died. There were 600 requests for her to please help. And as Secretary of State, she went to bed. And you just wonder if hypothyroidism really is the issue, as Dr. Drew suggested, and she has to sleep more than she should. Does she need to be the person who's ultimately at the situation table when crises arise for our country?
Right. Well, I mean, there's valid questions that you're having on two areas. One is that I heard her in the Commander-in-Chief forum last night, and she didn't seem to have a memory problem to me. She seemed to be very much on point with her facts and her knowledge, and I will give her that. You know, when I make these statements on air, I really try to take a non-political point of view and try to be as honest as I can and just look at things clinically, and that's what I saw. As far as Dr. Drew Pinsky, you know, he was talking a lot about her having 1950s healthcare, and he was alluding that the fact that she was taking Armour thyroid, which is a thyroid medication that is he was saying an older medication, is outdated, and that her health care is outdated, and a lot of information was left out. I happen to disagree with Dr. Drew Pinsky on that issue, okay, because the fact that she was given Armour thyroid tells me that likely her doctors must have thought that she lacked T3. Most people who have hypothyroidism are treated with either Synthroid or Levoxyl because it's common knowledge among healthcare providers that a patient can convert T4 to T3. T3 has a very different function in the body as T4. So the fact that she was given Armour thyroid, which has T3 in it, shows that her doctors were trying to supplement her with T3. The problem with Armour is that medication is derived from the pig. So the ratio of T3 to T4 is not humanly appropriate. It's not appropriate for humans. It's not the best ratio for humans. So were her doctors erred? No, because that's the medication that's out there. I mean,
yeah, and it's hard to know. Even sometimes I know that doctors will prescribe older medications for their own reasons, because maybe they have experience that, you know, it's something that the newer one isn't better for that particular patient for other reasons. But here's the thing. You mentioned last night, and I'm glad you brought that up at the forum last night. She used the word mistake many times last night. She admitted to making many mistakes as Secretary of State. In some cases, those mistakes cost lives. You can't make so many mistakes when you're president. So at what point do we think about the stress of being president and what that might add to her stress level? I mean, you look at how presidents age as they go through being the president. Obama looks much older than he did when he started just 8 years ago. Hillary, who's suffered falls, concussions, memory loss, etc. Do you worry that the stress of the job might be too much for somebody who already obviously has memory problems, as her own assistant said, has had health problems, and obviously stress isn't going to help any of that?
You know, to be honest with you, I haven't seen a president who hasn't aged. I haven't seen a president who hasn't had problems. Most presidents age, and are we focusing more on her aging process because she's a woman running for office? You know, does that have something to do with it?
I don't know. I think both men and women age, but unfortunately, I have to let you go because we are right at the end of the segment. Thank you for being with us, Dr. Palmer.
Thanks for having me.
Our hashtag rapid fire round. Stay right where you are.